In this presentation, we will explore acute mountain sickness, AMS, and its progression to more severe forms, high-altitude pulmonary edema, HAPE, and high-altitude cerebral edema, HACE. We will define these conditions, understand their causes, and outline prevention and treatment strategies. AMS affects up to 50% of individuals ascending rapidly above 10,000 feet, while HAPE and HACE occur in 1–3% and less than 1% respectively. Acute mountain sickness, AMS, is the initial response to reduced air pressure and lower oxygen at high altitudes. Common symptoms include headache, nausea, fatigue, dizziness, and insomnia. The Lake Louise scoring system assesses AMS severity, with a score of 3 or more indicating AMS. High-altitude pulmonary edema, HAPE, is a life-threatening condition where fluid accumulates in the lungs due to increased pulmonary artery pressure. Hypoxic pulmonary vasoconstriction leads to uneven blood flow and capillary pressure. HAPE affects 0.52% of individuals ascending rapidly above 9,000 feet. Early symptoms of HAPE include dry cough, shortness of breath, chest tightness, and decreased exercise performance. Later symptoms may include pink, frothy sputum, severe breathlessness, gurgling sounds, and cyanosis. Presence of respiratory symptoms and signs, with SpO2 typically greater than 90%, are diagnostic criteria for HAPE. High-altitude cerebral edema, HACE, is a severe form of AMS characterized by brain swelling and neurological dysfunction. Increased cerebral blood flow and permeability cause fluid leakage into the brain. Onset is usually above 9,000 feet but can occur lower in susceptible individuals. Early symptoms of HACE include severe headache, loss of coordination, vomiting, and progressive fatigue. Later symptoms may involve altered mental status, seizures, coma, and focal neurological deficits. Diagnostic criteria include altered mental status or ataxia in a person with AMS. To prevent HAPE and HACE, ascend no more than 1,600 feet per day above 10,000 feet and include rest days. Follow the climb high, sleep low principle by ascending during the day but descending to sleep at a lower altitude. Pre-acclimatization and medications like acetazolamide, dexamethasone, or nifedipine can also help. Treating HAPE involves immediate descent as quickly and safely as possible. Even 1,500 feet can save a life. Administer oxygen to maintain SpO2 greater than 90%, use albuterol to help open airways, and nifedipine to reduce pulmonary artery pressure. Similar to HAPE, treatment for HACE includes immediate descent and administering oxygen to maintain SpO2 greater than 90%. Dexamethasone can reduce brain swelling, and acetazolamide may be considered. Close monitoring of neurological status and vital signs is crucial. AMS, HAPE, and HACE are serious altitude-related illnesses that can be life-threatening. Gradual ascent and prophylactic medications can help prevent these conditions. Early recognition and immediate descent are crucial for effective treatment. Educate yourself and others, and seek medical attention immediately if symptoms develop.